I'm Jeremy Davis, and I'm a surgical oncologist in the Center for Cancer Research at the National Cancer Institute in Bethesda, Maryland. And my particular focus is on cancers of the upper gastrointestinal tract, so the stomach, the small intestine, the pancreas, and the liver. Part of my research, however, is focused on cancers of the stomach. Hereditary diffuse gastric cancer syndrome is most often attributed to a mutation in a gene called CDH1. CDH1 is a tumor suppressor gene, which means that when functioning normally, it prevents cancer from developing. But when it's abnormal, it can allow cancer to develop, especially at a young age. But we really want to find them before that point so that we can better counsel people and educate them on what they can do to prevent cancer from developing. Right now, the best way to do this is with endoscopy, a tube that's inserted down the throat into the stomach to look for these cells. The problem with endoscopy is that it's not very sensitive at detecting these cells that are very small and they're hiding in the lining of the stomach. So the purpose of our trial is to use what's called confocal endoscopic microscopy to better visualize these cancer cells at a very early stage in the stomach lining in patients who are otherwise asymptomatic. The goal of the trial is to see if this confocal endoscopic microscopy is a better way at screening or performing surveillance on patients with hereditary diffuse gastric cancer syndrome. This study will also help support our research to try to find better ways to prevent this cancer from developing without having to remove people's stomachs as a way of preventing cancer. Patients interested in our study can reach us by phone, by email, or finding us on the web. 240-858-3610, foregut@mail.nih.gov, or ccr.cancer.gov/surgical-oncology-program.
U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute, cancer.gov, 1-800-4-CANCER. Produced December 2018.